Today's video is brow lift versus fat grafting. So the question is, which one will win? And honestly, it really depends on your situation. So I want to sort of go through when I perform a brow lift, when I perform fat grafting, when I perform blepharoplasty, and how about the old traditional just Botox brow lift if we're talking about trying to achieve a non-surgical result. What is my opinion about that? So we're going to address some of these issues and how I address it, what my philosophy is. So the traditional way that people come in is they take two fingers and they go, "Dr. Lamb, don't I look better?" The answer is usually yes. It's the same thing when you do a facelift comparison. You just pull up like this. The problem with this is that it doesn't necessarily reflect reality. So I hesitate just to hold the brow up and say that will work. Now, I actually do that as part of my evaluation, but for reasons that I'll try to explain. So the a priori, in other words, your just decision of you're holding your brows up will, of course, make you look better. The question is, A, did you ever have a brow that high? B, do you want a brow that high? And C is, would it make you look better? So when I talk about a brow lift, first of all, I want to explain to you sort of the history of brow lifting, where I've evolved with brow lifting, what technique I prefer for brow lifting, and where I don't brow lift. So the history of brow lifting, it's been around for decades. The traditional way was an open technique, which involved a very long incision. You could either do a coronal incision that was way back behind the hairline, you could do one at the hairline, that was called a trichophytic incision, or you could do one in front that would try to pull down the hairline called a pretracheal, or in other words, in front of the hairline. These techniques had problems, and the problems were long-lasting anesthesia, in other words, numbness that could be permanent, hair loss. I've had to fix a lot with a transplant. And those results were more predictable than what I'm going to talk to you about, but the negative issues also with a long recovery posed problems. So the advent in the 90s or so, late 90s, early 2000s, was something called endoscopic brow lifting. It's something I performed really for almost the first 5 to 10 years of my practice. And the great thing were there were small incisions, about 5 small incisions in the hairline that allowed you to go and release from that incision this what's called arcus marginalis, or this adhesion that's along the bone rim, to elevate it. The problem I found with this technique is that it really didn't give me very predictable results. I found that these brow results started to fail and fade back. I now use a technique called a subcutaneous brow lift. So what that is, it's a small temporal incision, and it's meant to just elevate the lateral tail of the brow. Now, why do I prefer this technique? The reason for it is that I always like the mantra, get as close to the problem as possible. So when you're far up here, suspending things, your elevation is going to weaken because the distance is too long. When you're closer, especially with women that they don't have, like me, a receded hairline, where I'm more commonly doing it in women than men, and we'll talk about that as well, is that I'm able to get much closer to the problem. The other thing is the proximity to the problem is that it's a skin sag. And so when we talk about a facelift, I go what's called a deep plane facelift, because the problem is the deep tissues have to be released for elevation. I tried that with brow lifts. I found them to be unpredictable. So the closest to the problem is the skin surface. So we're talking about the actual literal subcutaneous area. So I do a very gentle dissection in the subcutaneous plane. The nerve for movement is actually much deeper than that in the superficial temporal fascia, not that much deeper, so I'm very, very careful. I just elevate that area right in the subcutaneous plane, and that way I elevate just the skin, and I found that that's where the problem is. So the closer you get to the problem, the better, and that avoids all the incisions on the hairline and everywhere else. And it's not a perfect result, because there's no such thing as perfect results. Like my fat grafting results are not perfect either. Nothing is perfect. Everything is an improvement, but I like the predictability and I like the outcomes. Now, what about the scar along this area? So what I do for that area is I do a very careful what's called trichophytic incision, which means I actually bevel across the actual hair follicles, and then I inject with Botox to make sure it really heals well. And that incision typically heals quite well when it's limited in its scope and in trying to elevate that area. So the natural question is then, when do I perform a brow lift versus a fat graft? So let me tell you the counter perspective of a fat graft, which is a lot of people think, why would I put more heaviness into my brow when it's already heavy, Dr. Lamb? You make no sense. So I used the analogy like a balloon. When a balloon deflates, it looks like it's sagging, but it needs to be reinflated. And when it reinflates, it looks actually elevated, which is sort of crazy, right? Because you think, well, what is going on with this? Why would I fill something that's heavy? Well, once it's not sagging anymore, filling it will help. Now, do I always just fill it and not do anything else? Well, let's break down sort of the anatomy of what brings my eye to think about what I should do. So the other component of the upper eyelid is the blepharoplasty, or little skin removal of the upper eyelid. A lot of people, when they do blepharoplasty, they remove skin, they just take a muscle away, the skin away, the fat away, they take everything away, and I actually think they further hollow the eye, they actually further worsen things. And I think a brow lift by itself, when it's not done in tandem with other treatments, like maybe a fat graft, sometimes, not always, can make this area more skeletonized. So you think about, for me, I'm 55 years old. Oh, sorry about that. I'm 55 years old. If you look at me, I'm hollow, and if I lift my brow up, it actually becomes even hollower. So the idea is that this hollowness that is occurring with aging, we typically think that hollowness is something that we don't even look at. But when we really look at it, the skeletonization of the orbital rim bone, you can see my eye bag, you can see the hollow rim around my eye. That hollowness is a sign of aging. And so my glasses do a great job of covering it. So fat grafting is addressing the volumetric loss around the eye. So a lot of people just can't understand that. And it's probably one of the most difficult things I have to explain. I spent a long time during my consultation trying to explain that using photographs, and that way people can get a better grasp of it. But the bottom line is you have to come in for a consultation so that I can sort of see, or if you're a virtual consult, I can look at your photos and make a decision. So let's break down that I use this combination of brow lifting, fat grafting, blepharoplasty to get the results that I need. So if someone just has a little extra skin, or they don't want to do a fat graft or a brow lift, the skin removal by itself oftentimes does a really good job. It's a very short recovery, easy procedure, but it doesn't really address the volume loss and or the brow sag. So these are the components that we're looking at. To me, my most common scenario is a blepharoplasty with fat grafting, which is less common as the brow lift, because I think that brow lifting is overperformed. I perform brow lifting when I really see enough lateral hooding. In other words, this area really sags out here, and I feel like a little skin removal that goes just beyond it is really not going to capture. The fat grafting will not reinflate it. Then the brow lift can be an amazing adjunct or component with hopefully very limited downtime to it and a very small procedure, because again, I only believe in lifting the tail of the brow. A lot of times we think, well, we need the middle brow elevated, but I think this creates a very surprised look, and so especially with these more aggressive techniques of large incisions, even endoscopic lifting of the central brow and elevating that complex going up, I think there's too much elevation of the central brow. There can be a little bit of a surprise look. So what I'm really focused on is just a little bit of lateral tail elevation. So I would say there's more indication in my hands and my bias toward fat grafting and blepharoplasty than it is brow lifting. And brow lifting for me is not the primary method, but is the adjunctive method to help further improve sagging of the lateral outer brow and hooding. It doesn't work as well in my hands, in my opinion, as a standalone technique for the reasons I've enumerated, but I really support that using my photographs to show you that in context with these other treatments it works really well, but as a standalone I think that it just creates sometimes more hollowing and it doesn't address all of the problems. Now, when would I perform a blepharoplasty versus fat grafting? So if the skin looks crepey and doesn't look healthy, if it sits on the eyelid margin of the skin, in other words, on the eyelashes and it's hanging over it, then a fat graft is only going to create so much ballooning on that area. It's going to create too much heaviness on the eyelid. It won't look good. So when it sits there, the skin removal is a critical element to the whole equation. So if the skin looks crepey and it's sagging over the eyelid, blepharoplasty becomes very, very important. When the eye is hollowing and you can actually see the orbital rim bone, like I showed you sort of in my eyelids, then fat grafting, in my opinion, becomes very important. When there's lateral hooding of the brow sagging downward, coming out from the outer portion that you just cannot capture with a blepharoplasty or with fat grafting, then a brow lift becomes important, using my sort of limited subcutaneous technique that I believe addresses more potency, more power, with less work and less dissection and recovery. So hopefully that's a good overview of things. Now, I mentioned at the beginning of the video a little bit about a Botox brow lift. We hear about that all the time. I know this video is mainly geared toward a surgical result, but we hear this all the time. And sometimes what happens is you do a Botox brow lift and you go, wow, I really like this, I want a brow lift. As I told you, number one is that lifting of the brow is not necessarily the best option always for you. Sometimes the fat grafting may not only simulate it, but actually improve the result beyond what you could expect. But also, in my opinion, Botox brow lifts are very short-lived. They only stay for 2 to 3 months, in which case, if you like that look, you've got to constantly Botox it to maintain that result, which in my opinion is a waste of money. So if you listen to my Botox virtual consultations, I talk a little bit about the quality of cleaning up the skin texture, the wrinkles, and that's the power of Botox, where you could go a year without it. But Botox brow lift on the other side makes you hooked on it. You actually have to keep on maintaining it. Now, is it a bad thing? No. If you like it, we can do it. The other problem with the Botox brow lift, it's based on the idea that you have to put limited Botox in the forehead, where there could be a lot of wrinkles there. So, for example, let's say there is a decent number of wrinkles here, and you actually hold your brows up a lot, and you want the brow lift result here. That's not a bad thing, but I can't treat these wrinkles because the forehead is an elevator. So when you block the elevator, then the other muscles will pull down. If you block both, it won't go up. So the way a Botox brow lift works is by blocking depressor muscles like the corrugator procerus and the orbicularis muscle, and not blocking the forehead muscle called the frontalis. And that, if you don't block the frontalis muscle, it can elevate. But if you block the frontalis, which is managing the forehead wrinkles, you're not going to get enough elevation on it. So this is the idea of, if you like the Botox brow lift, you also have to somewhat cheat on not getting all the wrinkles done on your forehead. And that's what you sometimes see, these really fake results where people skip the outer tail and you get these Spock peaks. And people, I like the Botox brow lift, but they look fake. So these are the reasons why, in my opinion, Botox brow lift is not the best idea. Final point I want to talk about is, how about brow lifting in men? How often do I perform that? Very rarely, honestly. I think men look good with very heavy set brows. I don't think they look good with high brows. But if they've got a lot of lateral sag, and that usually occurs with a lot of aging, and so if there's a lot of aging with that eyelid, I'll do it. The other problem is with any kind of brow lift incision, men have some level of recession. That causes several problems. One is, if you see me, it's back here. So that automatically sets up a problem with distance. Because remember, what I said is that the shortest distance to the problem creates the best results. And also, as I told you, the depth. In this case, it's as short a distance to the depth of the skin is also helpful, because the skin is the sagging. So depth-wise, short distance, distance-wise, short distance. And so with men, there's natural recession, and you worry about further recession. So the younger you are doing a brow lift, first, I don't think you need it for men. Second of all is that incision could be exposed as that hairline recedes. Now, I can do a transplant, as you know, but it's not always safe. If I'm doing a transplant on a young person, that area recedes, I could then have to do more transplants. They may not have enough donor hair to fix it. That becomes problematic. So in general, I'm not as big a fan of brow lifting in men, whether it's a Botox brow lift or it is a surgical brow lift. And it's not an absolute, as I told you, in older individuals where they have a lot of that redundancy, a lot of that sag of that outer brow, and you just can't remove that skin appropriately, the brow lift can definitely help, especially if their hairline is stable, and especially if they don't have a very far receded temporal recession. I think that's the perfect storm for a male brow lift, but it's not something I perform all the time. So hopefully this video about my philosophy regarding brow lifting versus fat grafting, and with or without upper eyelid blepharoplasty procedures or cosmetic eyelid surgery, is helpful for the viewer out there, especially if you haven't come in for a consultation with me, or even if you come in for a consultation, to reinforce some of these concepts for you.